Hi ladies, do you know your nipple type? It can be really beneficial to get to know your nipple type during pregnancy, as knowing what certain nipples require can make your breastfeeding start easier. For the purpose of breastfeeding, nipples are usually divided into three main categories. What would usually be classed as a normal nipple is the nipple that is protruding. A flat nipple is the nipple that is level with the areola, and an inverted nipple is the nipple that is pulled into the breast and it's more or less sitting in the breast. For the demonstration of inverted nipples, I usually like to use a knitted sock to show how the inverted nipple is pulled into the breast and sitting inside the breast, attached with adhesions to the inside of the breast. There is a simple test that you can do on yourself to find out what nipple type you have. It's called the pinch test, and with the pinch test all you do is you make a C shape with your thumb and four fingers and about 3 centimeters behind the nipple. Often that will be just at the edge of the areola. You gently compress. If when you're performing the pinch test, your nipple remains protruding, that means you have a normal nipple. If it looks like you're having a flat nipple and it's level with the areola, when you're performing the pinch test, it comes out a little bit and is also everting a little bit upon nipple stimulation. That shows you that you probably do have a flat nipple, but with some work it is everting. And if the nipple is truly pulled into the breast, even when compressing during the pinch test, then that gives you an indication that probably you do have an inverted nipple. It is quite normal for mums to not be entirely symmetrical size-wise or nipple-wise. So you could have a normal nipple on one side and an inverted nipple on the other side. You might have two flat nipples or a flat nipple and a normal nipple. That is all normal. Bear in mind that when babies breastfeed, we expect babies to attach to the breast, not just the nipple, but also the areola, take a large mouthful of breast. So we don't want babies to nipple feed, we want them to breastfeed. For that reason, babies have the ability to work with, to a certain extent, whatever they are presented with. They don't automatically expect something sticking up to attach onto when they're born. If we just think of babies being skin to skin with dads, they also sometimes try to, when they're bobbing, they try to attach to a shoulder or another part of dad's chest. What we do see though is that mothers who have flat or inverted nipples, that they often require a little bit more lactation support and lactation input once baby has arrived. And I think sometimes that's not addressed enough. Perhaps we fear that we might put mums off breastfeeding, but I think if they're informed that these are the challenges that they might encounter with attachment, then they can get organized and prepared for that postpartum time. So I'd love to know whether if you had a flat or inverted nipple, did you know about breastfeeding challenges that you might encounter postpartum while you were pregnant? Leave me a comment, I'd love to know. I don't want to sound discouraging by any means at all. It is definitely possible to breastfeed with inverted nipples. Your baby is able to break those adhesions over time and make the nipple a little bit more everted. But I am in favor of having a breast check with your healthcare provider early on in pregnancy, around your booking appointment, which is usually around the 12 weeks mark. Not just to determine what type of nipple you have, but also to check your breast anatomy and just to have a general breast check, which is really important for women's health, and also just to get a baseline for breastfeeding. The reason why I am in favor of a breast check early on in pregnancy, especially for inverted nipples, is because of one specific product that you can use to help transform inverted nipples, which you can only use during the first and the second trimester of pregnancy because it works on the principle of nipple stimulation. And if you were to use that in the third trimester, there would be the fear of the nipple stimulation potentially triggering preterm labor. So you wouldn't be able to use that in the third trimester of pregnancy. The product I'm talking about is called a Niplette. And by the way, this video is not sponsored at all. I've just had very good experiences with this product on a personal and also on a professional level. This product was originally designed to correct flat nipples or inverted nipples in models, but you can also use it to prepare for lactation. You cannot use this, as I said, in the third trimester and when you're already breastfeeding. You have to use it before the third trimester of pregnancy. Before you use the Niplette, and generally when working with an inverted nipple, you can apply a little bit of lanolin, which is one of the general nipple care products. In fact, the nipple care product of choice. It's made of purified sheep's wool and it's quite sticky, so you don't need an awful lot, so just apply that sparingly to the inverted nipple. And then the thimble part of the Niplette, you place that over the inverted nipple. And what the Niplette's supposed to do over time is pull out the inverted nipple, and it comes with a 5 ml syringe, and you basically create a vacuum with the syringe. So over time you can increase the strength of the vacuum as you wear this product over a couple of weeks. So the syringe creates a vacuum. This is quite a lot, so you'd start with a little bit less, and then you can detach it, and this part remains sitting in your bra. You can wear it overnight. Most women find that more convenient than during daytime, and you can gradually increase the strength and the time, and you can wear it up to an entire night. But always do follow the manufacturer's instructions with any product that you're using, but it can create noticeable results. If you're already in your third trimester, you can wear a breast shell in your bra that is also supposed to encourage the nipple to come out a little bit more. It doesn't work with active nipple stimulation though, so you'd be okay to start wearing this from around 37 weeks of pregnancy when it's safe. You could start with an hour in the morning and an hour in the evening. Although these breast shells, they're also called nipple formers sometimes, they have been found to be more effective to wear between feeds when you're already breastfeeding than at the end of pregnancy. But if this is something you would like to try, you can start wearing them at the end of pregnancy from around 37 weeks. So with the breast shell, your nipple is placed into the hole here. It's two parts. It's the soft silicone part and then a cup overall. It's got holes in here to allow for air circulation, and then the nipple is placed through the hole here, and the shell sits in your bra, and with a little bit of gentle pressure behind the nipple areola area, the nipple is encouraged to come out a little bit and hopefully stay averted a little bit when you're taking it off for feeding. Another thing you can also do for inverted nipples at the end of pregnancy from around 37 weeks onwards, again, is the Hofmann Technique, whereby you place both your thumbs just at the base of the nipple and apply a little bit of pressure for about a minute or so, and then you pull back, and then you work your way around the nipple and you pull back, and that is supposed to also break those adhesions of the inverted nipple and help it protrude a little bit more. When you're using this technique, you can start in the morning for up to 5 minutes, and then gradually increase it to 3 times a day. Before you start with this technique, also apply a little bit of lanolin, like with the Niplette, to make the nipple more elastic to work with. The Hofmann technique that you'd use at the end of the pregnancy is very similar to the reverse pressure softening technique that is usually recommended for when your breasts are very engorged. This can happen as your milk comes in and your baby is struggling to transfer the milk effectively. Also, you might have had a lot of IV fluids in labor that have made your breasts quite edematous. So adopting a laid back position in that case can help to the gravity to pull the fluid back into your circulatory system, but also laid back feeding can be very helpful for flat nipples anyhow. For the reverse pressure softening technique, you place your fingertips left and right of the nipple at the base of the nipple, and again you'd apply some pressure, hold that pressure, and then brush back towards the chest wall, and that way you work your way around the breast. You can do it with your fingertips, or you can make a scissors hold and also apply some pressure and then brush backwards towards the chest wall. Before latching on, some mums feel that applying an ice cube for a short amount of time can help, or working with your manual or electric breast pump to stimulate the nipple to come out can help as well, because it is a pumping motion back and forth. The nipple goes in and out, so you have to be fairly quick then moving the breast pump and then bringing your baby on quickly. The same goes for another gadget that's called a Latch Assist or a nipple everter, which is essentially almost like a tiny little manual pump. You can get a Latch Assist for around 10 euros or so. It's not to be used during pregnancy. It's meant for to be used just before latch on. And the way you use it is just you compress this little balloon here, and then you bring the mole part directly over the nipple and areola area, and then you let go, and you can see it also pulls the nipple out, and then you have to be quick to when you let go of the Latch Assist to quickly attach your baby so that the nipple doesn't go in. After feeds, sometimes moisture from the breast milk and the baby's saliva is collecting or pooling inside the inverted nipple, so be sure to pat that dry with a muslin cloth before applying lanolin again, because otherwise that pooled moisture could cause soreness. As you can see, there are quite a few techniques and gadgets you can use to help you on your breastfeeding journey with inverted nipples. I do have a summary of all the products that I've talked about in this video, and I will link it here for you as well if you want to go ahead and print that out. In terms of helpful breastfeeding positions for flat or inverted nipples, I made videos in the past. One is the koala breastfeeding hold, and the other one is a recent video I made about breast shaping and breast holds for latch on, so you might find those helpful. If you really have tried everything and latching your baby is not successful, you could always try a nipple shield temporarily. Again, I've made a video on feeding with nipple shields and then weaning off nipple shields when the time comes, when your baby has broken those adhesions and pulled out your nipple and made it more everted. As breastfeeding is so individual, the tips I've shared in this video, they have helped some mums who fed with flat or inverted nipples, but they might not work for you. So in any case, it is really advisable that you check in with a lactation consultant and your healthcare professional, that they can monitor your progress and your milk supply and the baby's weight gain, and also always follow the manufacturer's instructions before you use any of the products that I've mentioned in this video, and also check with your healthcare provider. In my online breastfeeding course, Breastfeeding Basics A Practical guide, I have a whole lesson dedicated to general nipple care and feeding with flat and or inverted nipples. So I link that here for you in the description box as well if you'd like to check it out. And otherwise, until next time, I hope your breastfeeding journey is going well.